Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, everyone, and welcome back to this week's episode of the Tongue Tie Experts podcast. This one's for the dentists. I am going to talk to you about what I think is important and what other professionals have told me is important to know if you're a dentist. Now, if you tuned in because you're a dentist who is either already releasing tongue ties or is curious or just starting out, welcome and thanks for being here. I want to acknowledge you and honor your commitment to learning best practices and being open to learning from someone other than another dentist. So in our world, we typically learn from providers in our niche, right? So dentists learn from dentists, midwives learn from midwives, lactation consultants learn from lactation consultants, nurses learn from nurses, doctors learn from doctors, et cetera, et cetera. I think you get the point. But the world needs more providers like you who are willing to come together in interdisciplinary learning. If we are going to have interdisciplinary practice, we need interdisciplinary learning. So if that's something for you, you're in the right place. And thank you so much for being here. If you are a dentist, that's great. If you aren't a dentist or a release provider, keep listening anyway. These points are universal, and we have to be multidisciplinary in our learning and practice so you are not excluded from this conversation, no matter what your title is. And if you are a parent who is listening, you will soon realize that you can learn who the best dentists are for release by knowing if they follow these best practices. So let's get into it. I have come up with a list of six points that I feel are impactful for release providers. But I want to start by considering the awesome responsibility you have as a release provider. My friend, Dr. Scott Siegel, who I consider and most people consider one of the pioneers in the field, has said that his part in things is the easiest. It's a relatively quick procedure, not as time consuming and counseling intensive as those of us, such as lactation consultants, who are more therapy minded. But as a dentist, there you are with a new family in front of you, looking to you for answers. These families are at a very vulnerable point in their lives, in an important part of their lives, looking to you for possibly an instant solution. Perhaps they have been told that you are their only hope, or perhaps they have been through all else and this seems like the last hope for them. This is an awesome responsibility, and I don't think anybody takes this lightly. And if you're not affected by that responsibility of it, then I don't think you're a true human. You have to realize that. But I'm not sure that everyone who's a release provider comes to it realizing this at first, right? You just think, well, it's another procedure I offer. But it's so much more than that. Frenotomy is so much more than just another procedure you offer. And you have to have the right mindset and look at the family in a holistic point of view to understand just how awesome this responsibility is. Now, hope I'm not scaring you away, because there are many people who do this beautifully, and you can too. But here are a few questions to ask yourself before deciding whether or not this infant in front of you is ready for frenotomy. Number 1, are you considering the function of this tongue? Tongue-tie treatment is so much more than assessing what it looks like. Ankylosing is a functional assessment or diagnosis, not just a structural one. So we don't want to just look and see. Coming to number 2, has there been a comprehensive assessment? We want to have a comprehensive assessment. For a breastfeeding patient, that is typically an IBCLC, because the function that we are talking about is breastfeeding or bottle feeding. And the IBCLC is the specialist, the niche down provider, the gold standard to have a functional assessment of the breastfeeding dyad, the mother and the baby. The breastfeeding parent and the infant have to be evaluated together. If you are dealing with older children, perhaps it's a myofunctional therapist or a speech language pathologist, right? But for a baby, it's a lactation consultant. Often other assessments should or could be made by body workers, such as craniosacral providers, physical therapists, occupational therapists, chiropractors, osteopaths. This is a multidimensional, multifunctional assessment. So if you have someone in your office who provides this service, that's fantastic. Or you need to network with providers in the community, or know that the family saw somebody. And those providers that the family has seen should be the people that you're networking with. So it goes both ways. So we're going to look, number 1, tongue function. Number 2, comprehensive assessment. Number 3, are you sure there is a tongue tie based on the symptoms correlating with a poorly moving tongue? So we can have feeding disturbances and feeding difficulties and difficulty with latching and poor bottle feeding from other things going on in the mouth, not just the tongue tie, right? So you want to make sure that it looks like a structural tongue tie and the symptoms are correlating there. Number 4, are you sure there is nothing else beside the frenum causing the decreased function of the tongue? So I'll give you an example. I had a baby a couple of weeks ago who had and I'm going to change identifying things, so I'm not giving away who this is, but this baby had, when I looked under the tongue, had a tongue tie. However, This baby had been bottle fed from birth and did well on the bottle. And parents didn't put the baby to breast more than once a day, and the baby had difficulty with the latch. And there was a decrease in the maternal milk supply. So there were reasons this baby wasn't breastfeeding that had nothing to do with the oral restriction. So the reason the baby wasn't breastfeeding is because they were bottle feeding, not because there was breastfeeding difficulty. They were bottle feeding for other reasons. So the baby took the breast right away, but the parents decided, as they have every right to decide, that they wanted to do mixed feeding. And they slowly came from feeding at the breast to mostly bottle feeding. And now they wanted to breastfeed, and the baby couldn't latch. So when I looked under the tongue, yes, there's a frenum that looks restricted and the baby's having difficulty moving their tongue, but that's not the reason this baby isn't breastfeeding, right? So you want to be really careful, because if we fix that frenum, that baby's still not going to breastfeed, even if it's the parent's goal, without a lot of other work. So that's one example. Have you ever wished you could help that mom who is questioning if she has enough milk? Ever wanted to either reassure her or know when to refer? As a lactation consultant, I created the program Understanding Milk Supply for medical and birth professionals to help you to feel more confident in those exact situations. This affordable, recorded video mini course is open to anyone who works with pregnant or breastfeeding families. It's a particularly valuable opportunity if you're an SLP or an OT who wants to gain an understanding of how breast milk is made, or a dentist in the field who is often the first-line provider for tongue-tie treatment. The function of the infant at the breast depends on milk supply. Even if care of the mom isn't in your scope, there are basic principles that you can learn that may rescue a family's feeding goals. In Understanding Milk Supply, I teach you what red flags to look for, when to refer, who to refer to, and how to advise the family in the meantime. And there's one LSERP included for lactation professionals. Go to www.tonguetieexperts.net/milk supply. The link is clickable in the show notes. And as always, you can use coupon code PODCAST15 to save 15% off this and all Tongue Tie Experts courses. Thanks so much. So being sure that there's nothing else besides the frenum causing the decreased function of the tongue or the difficulty of that baby to eat. Another example is some kind of structural tightness or inability to move the muscles of the head, face, and neck, or having hypomobility or hypermobility of the muscles, and something like torticollis, where they prefer one side to the other and have difficulty turning the head to latch or to put their head back to latch and get a nice deep attachment to the breast, not just the tip of the nipple, right? That could come from difficulty in the neck or the upper back or even the hips. So yes, that baby might look like they have a tongue tie, but is there anything else causing that difficulty or the symptoms in mother or baby that we need to correct before releasing the tongue? Again, this is important because we don't want to be releasing a tongue and then nothing gets better because there's so many other things going on, right? So we want to be sure that we're doing this for the right reasons and that everything that we are considering is controlled, or you're getting therapy for, or we are optimizing the function of everything before we do the release, if possible. So going down the list of what I want dentists to know, or what dentists need to know when they're starting out or practicing doing frenotomy procedures. Number one was, am I considering the function of the tongue? Number two is a comprehensive assessment by a functional provider. Number 3 is being sure that there's a structural tongue tie. Number 4 is making sure there is nothing else besides the frenum causing the decreased function of the tongue. Number 5 is the mother-baby dyad physically ready for the release? And I have a whole module about this in Professional's Guide to Tongue Tie in the Breastfeeding Infant, which I'll link to. This is multifaceted, but it includes healing from birth, being physically able and emotionally ready to perform post-release exercises, having had pre-release treatment, and understanding the process. And we'll go into that a little bit more. So there are many reasons why a family may not be ready for a tongue tie release. Physically, I like to think about maternal milk supply, optimizing that if possible, and also having the mother and baby both recovered for whatever may have happened in birth or postpartum. For example, if a mom lost a lot of blood and during, not to get too gory, but if they had a postpartum hemorrhage or just a heavy bleed and they're very anemic, we want to build them up. We want to make sure that's being treated before we give them another stress on their body. This is a very functional, holistic way to look at things, but we want to handle the stressors on the maternal side, both physical and emotional, before we decide that this baby needs a surgical procedure. Whether or not frenotomy is a quick and easy procedure for the provider, it's really stressful for the parents, right? And it's a stress for the baby. If this baby was a NICU baby, we want to have time for them to have acclimated and adjusted to being home together. We want them to recover from the NICU experience, if possible. Having lots of time, skin to skin, being able to come to their own routines, get to know each other, right? That's a traumatic experience. And a lot of our NICU babies do need tongue tie release, but we want to make sure that we are considering all the parents prepared for that. So the last point that I want to make is number 6, education and informed consent. We want families to understand that this is an option for them. It's not mandatory. We never want to make a family feel pressured into having a procedure, no matter how minor it is, that they haven't fully invested in. Knowing this is important for your own protection. It's important legally. And it's important morally to feel like you are giving your families, the families that come to you in care, the complete story of what this is going to be. Do not ever make it like it's a quick fix, because in a lot of cases it won't be. You want to set realistic expectations and let parents understand that this is a journey, that it may help right away, but it may not, that it might be difficult, that the next couple of weeks might be challenging, and they should understand what they have to do. So going along with that, setting those realistic expectations are explaining the healing process and the importance of follow-up care. And that includes not just you, but the functional provider they were seeing, of course, their pediatrician, and whatever other therapies were recommended for them. You want them to understand that if they can't perform the post-release care that you are prescribing for them, there is a higher chance of reattachment. Now, there's not tons of research on that. We're beginning to get the research on that. But we do know, those of us who have been doing this for a long time have seen this in our clinical practices over thousands of babies, that if there's no post-release care that supports optimal wound healing and muscle function, there's a chance of reattachment or a chance that there won't be any improvement in symptoms. So education is key. It's one of the reasons why I have my packet that I've honed over all the years of taking care of mamas and babies in this situation, where I have a packet that I give to the parents depending on what their needs are, all about these things. Like, you want to have something about the signs and symptoms. You want one about aftercare. You want one about exercises, about interdisciplinary care, about how, answering their questions. So you want to have that packet. That's also part of my professional's guide if anybody's interested in that. Or sometimes I sell that individually too, if anybody needs education for their patients. But this is key. You cannot educate enough, and you want to educate in different forms, because some people want to hear it. Some people want to read it. Some people want to have it on their phone, right? So those are the forms that I offer, and I have found it really helpful to have something ready to share with families. And it also gives families confidence that they're with someone who does this. They're not just with someone who is doing a procedure. They're with someone who is interested and cares enough that they have taken the time and developed education resources for them. So if you don't have the resources, there's tons of things that you can find online that you can refer to, including my stuff, or you can purchase my stuff, or you can look at, from your own experience, but you want to have something to hand patients so that they go home with something, because their minds are going to be overwhelmed with emotion, with trying to decide what's right for them, what's right for their baby. And it can be very confusing for those of us who understand this. From a new parent's perspective, somebody who may not be sleeping as much as they need, may be behind in nutrition, may have driven a long time to see you. We want to respect that and give them what they need. So I hope this hasn't scared any of you from becoming a release provider, or from thinking you're not doing the right thing, because we know better, we do better. All of this comes from the years of experience. Now it's going on 12 years that I've been taking care of babies with tongue tie, 10 years in private practice. I can't believe how quickly that happens. And the thousands of babies that I have seen, and knowing the babies who do the best are being treated by dentists who have a system for best practices like this. So thanks for joining us. There'll be links in the show notes. Send me any questions. Talk soon. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.